अस्सलामुअलैकुम सर।
वालेकुम अस्सलाम।
सर कैसे हैं आप?
अल्हम्दुलिल्लाह।
सर थैंक यू सो मच, आपने हमारे लिए टाइम निकाला। हाँ, आपसे कुछ क्वेश्चंस पूछना चाहेंगे।
जी जी
ये सब
वेलकम।
आपसे सुनना चाहते हैं
जी
बेसिकली।
वेलकम जी वेलकम।
सर आप अपने चाइल्डहुड के बारे में कुछ बताएं, आपकी कोई मेमोरीज बचपन से।
Basically, I belong to a very small city known as the Shorecourt city in the district Jang. So my primary and high school teaching and the college teaching for the FSC was from the Shorecourt city, and then I basically came to. Well, I was one of the student amongst, I'd say, only two students they got admission in the medical education during that period from that college. So I basically was, as like other people, planning to go for the medical side, but ultimately I ended up in the BDS in De Montmorency College of Dentistry, Lahore. From the very first day, by the grace of Almighty Allah, I was not that hard working person basically, but a regular student, and similarly, always trying to go for regular studies on daily basis. So, by the grace of Almighty Allah, I passed all of my exams in first position, and in final year, I got the gold medal. And in my opinion, probably too much hard work and too much time to be given for the studies is not the basic need, even to come at the highest place. The most important thing is the regular study of the medical profession. If you are doing the things on a daily basis, probably at the end of the day during the examination, you don't need to have a lot of pressure, and you don't need to study for a very long period in the night. So I will just advise that try to go very smoothly, and study the things on daily basis. Make your own questions, make your own notes, and even if you want to mark the books, to do it, because at the end of the day, these all things are really very helpful, and they help you to recall everything. If it is written by your own hands, if it is marked by your own hands, and if it is discussed with your colleague, make a group of 2 3 people who are good, and then always go for the discussion. These things probably they are really very helpful to recall your memory and keep the things updated in a very short time, and you are always ready to answer the questions in this way. And then after the BDS, I joined the health department, and I was in search of some post graduation. At that time, there was no post graduation at all present in Pakistan after BDS. We struggled for it. Initially, the diploma was started, then MCPS started, and then we got admission in MDS. And by the grace of Almighty Allah, I passed the MCPS in first exam in the beginning when the MCPS was started in 92 93, and later on I did my MDS, and I did my research on osteosynthesis in Pakistan. Probably it was the first study in Pakistan related to the plating on the maxillofacial region. So, by the grace of Almighty Allah, everything is fine. In the beginning, I have been teaching in the Montmorency College of Dentistry, and after completion of my MDS, I went to Saudi Arabia. For 3 years, I was the part of tertiary care hospital in Taif, and I learned a lot in Saudi Arabia because a lot of facilities were available, and we were able to manage every case by our own choice. So after coming back, I joined the Nishtar Medical College as associate professor in the Department of Oral and Maxillofacial Surgery. Later on, I joined CMH, Institute of CMH Medical and Dental College in Lahore, Institute of Dentistry. And for 4 years, I was in Institute of Dentistry in Lahore, and I was the pioneer surgeon in that college. After that, I joined in Islam Dental College in Sialkot, and by the grace of Almighty Allah, the results of that period has been the best. And we have been getting the positions in our UHS, and similar were the result in the Institute of Dentistry and CMH also. It was the new college, and for 4 years you can check the results. The results were excellent, and we have been getting the positions in the UHS. And same was the situation in Sialkot College. And now, by the grace of Almighty Allah, from 2014, I joined this Akhtar Said Medical and Dental College, and the classes were started from 2015. And from the very first session, we are getting positions in the UHS examination, and it's going on. I think by the grace of Almighty Allah, everything is going on positively now till now today. जी जनाब.
सर आपके कोई फ्रेंड्स या टीचर्स जिनको आप याद करना चाहें?
Really, there is a lot of difference between the teachers which were there at that time. The relations with the teachers were just like fatherly relations. Dr. Tariq Zaman was there, Dr. Wahid Sheikh was there, and even Dr. Nazia Yazdani, Dr. Muhammad Saeed, and all of these teachers probably they were so involved with us just like parents, and they have been teaching us very nicely, and they have been always with us for any problem which whatsoever we have been feeling. And I basically joined this oral and maxillofacial surgery because of Dr. Saeed involvement and help, probably. How in the maxillofacial surgery especially, it was the start of the department, and we were lucky enough that from the beginning we joined the oral and maxillofacial surgery, and I passed my whole of the time practically in oral and maxillofacial surgery. And my research in oral and maxillofacial surgery was very much different from the previous studies, because previously there was no plating done in Pakistan at all, and I was the pioneer for that, and I did a lot of research for that. And now everything is going on from Pakistan. Even the plates are being manufactured from Pakistan, and though they are being exported by duplicating it with proper titanium material. And there are 2, 3, 4 companies which are now exporting these plates and screws which are made up of titanium. And it was because of that effort which was started in 2000, rather I will say 1993, 94. And now I think in all the institutions of Pakistan, the plating is being done, and the plates are available which are made up of Pakistan, and they are of very good quality, and they are being exported also.
आपके ख्याल में एक अच्छे स्टूडेंट में क्या क्वालिटीज होनी चाहिए? आपके अपने स्टूडेंट्स के लिए कोई एडवाइस?
I think there are baselines given from the very first day by all the communities that we need to be very respectful to the teachers. And the teachers always are sincere with the students, because students are their reflection, rather I will say. If the student will perform good, the teacher will be happy. So teacher always want that the student should come up and they should be better than himself, because the teacher will always want that my student should progress as much as possible, because now probably it is the students who are going to tell something about us even. So secondly, I will advise to the students, make sure that these studies are not too difficult. What these studies they basically want is that you should be sincere to study, give sufficient time, not too much time. You should involve yourself in other activities also. That will help you to study more. It will not rather take you back. So if you are doing the things on daily basis, probably you are never ever under pressure. And if you will start with the good result, you will continue those good results. But if you don't maintain it from the very first day, probably, then it will be very difficult for you to come in the higher mark, student who are getting the higher marks. So that competition has to be there from the very first day. And that can be competed only if you are doing the things on daily basis. And I assure you that this practice for whole of your life is really very, very helpful. I personally don't feel that the students who are studying and giving too much time to the studies, they will learn more. I think probably, in my opinion, that is not the case.
सर आपका एएमडीसी में अपने कोलीग्स के साथ एक्सपीरियंस कैसा है? आप डॉक्टर सादिया को कैसे हैंडल करते हैं?
Basically, I am thankful to Almighty Allah that when I started this institution, all of my staff was just the new one. Nobody was the already experienced people. And I am thankful to Almighty Allah that all of them, they have been working hard, and that is being reflected by the results of the students. So of course, everybody has his own nature, and we need to deal the people accordingly. And I really appreciate Dr. Sadia that he is very energetic and very sincere, and she is always trying to take the people at the highest place. These strictnesses and these things, harshness and these everything, probably it is just on the spot or temporary, just to motivate the student, and its purpose definitely never ever like that she keeps in her mind and she goes to the negative side. It's not like that. I assure you that she is always trying her best, and her activity is always helpful for our teaching purposes.
सर आपकी कोई हॉबीज?
मेरी कॉमन हॉबीज में से आई एम जस्ट फॉन्ड ऑफ लुकिंग डिफरेंट टेक्निकल मूवीज. I am very fond of looking for new inventions in electronics, and always trying to use them in my practice. I don't know, I am in the medical field, but I am very much happy to open different machines, repair them, crack them. I am very much involved in the radiographic machines, and similarly technical things I liked, and I am most of the time I am trying to involve myself in those activities. And of course, the entertainment activities are also there, but not too much. So I also like to go through the history of Islam, especially by different means, but whatsoever the matter, you will use to get it. And I need to study the things accordingly, so that I can keep myself updated. That's how the things are going on. And regularly, as I am practicing in the evening, so the time which I get, usually I am trying to take myself updated regarding the studies.
सर आपकी कोई फेवरेट मूवी और फेवरेट सॉन्ग कौन सा है आपका? फिर अब तक ऑल टाइम का फेवरेट?
प्रैक्टिकली जो पुराने गाने हैं उनको मैं आमतौर पे सुनता हूँ, जो रियली दे आर हार्ट टचिंग, एंड दे आर रियल रिफ्लेक्शन ऑफ योर इमोशंस. सो टाइम टू टाइम वो आमतौर पे मैं सुनता रहता हूँ, कभी कभी कभार, बहुत ज़्यादा नहीं उसका शौकीन मैं. बाकी ये नए गाने मुझे कभी भी अच्छे नहीं लगे, ना ही मैं कभी शौक से देखने की कोशिश करता हूँ उनको.
सर आपका फेवरेट फूड क्या है? आपको खाने में क्या पसंद?
खाने में बहुत ज़्यादा चूज़ी नहीं हूँ मैं, बट ऑफ कोर्स इफ़ द टेस्ट इज़ गुड, आई लाइक दिस बारबेक्यूज एंड चाइनीज़ फूड, एंड of course other things also which are being commonly used, the kadai and the things I am happy to see, especially the vegetables if they are cooked in a nice way.
सर आप जो हैं एक बहुत अच्छे फादर भी हैं. आप फादरहुड के बारे में कुछ कहना चाहेंगे? डॉक्टर महविश के लिए कुछ कहना चाहेंगे? आपने मतलब उनसे हमेशा क्या एक्सपेक्ट किया? उनको किस तरह आपने?
मेरा ख्याल है कि मेरी फीलिंग ये है कि माई वाइफ एंड बोथ वी हैव बिन वेरी मच ओपन माइंडेड, and we have been listening whatsoever they are interested. I am thankful to Almighty Allah that they were hardworking and they have done their best possible. Of course, during the life, some things which are not that liked by the parents are always there. So that is a part of the life. But ultimately, everything is going okay, and I am always happy to see them happy and help them as much as possible and guide them as much as possible. so that they can come as up as possible in the life.
सर आप यंगर जनरेशन के लिए कोई मैसेज देना चाहेंगे?
मेरा मेनली मैसेज यही होगा, आई थिंक कि जी यंगर जनरेशन के लिए यही है कि जी दे शुड बी सिंसियर टू दैम सेल्फ, नंबर वन, एंड दे नीड टू टेक केयर दैट व्हाट थिंग्स आर गुड फॉर दैम. Their capabilities definitely are better than we people. They have a lot of exposure, they have lot of facilities rather, and instead of going to the negative side, I will advise all of them to be positive and get use of these facilities and take yourself up. Rest of the life is for you. If you will do, this is the only time which is the learning time. Once this time is over, then probably you won't be able to take it up. So always use this time as positively as possible, and always think for the good things, plan yourself for your future, and see the world by your thinking, and go for it and start the things at well in time. If you are planning to go out, you are planning to go for post graduation, the earliest possible time should be utilized for it, and we should start our work as early as possible. And I assure all of you have the capability, and you can fight for it, and you can prove yourself you are better than anybody else in any part of the world.
सर आपको कोई डिफरेंस फील होता है आपकी प्रैक्टिस सऊदी अरेबिया में और यहाँ में?
एक्चुअली बहुत फ़र्क है, इसमें कोई शक नहीं है, क्योंकि वहाँ पे फैसिलिटेशन इज़ बेटर. आई थिंक एवरीथिंग इज़ अवेलेबल, and the best thing in that environment was that their traditional working is very nice. Nobody ever has asked you or asked we people to delay any case. We were always we can think of it and we can proceed for the surgeries. The days were not specified, the time was not specified, and we were not under any pressure. Anything we like, we can do it, and whatsoever we wanted. And the most beautiful thing in Saudi Arabia practice was that on your one call, all of the consultants, the teams are available to coordinate with you and to do the surgical procedures in one sitting under the GA, and under the one roof. All of the consultants are available, and that type of practice probably is not seen in Pakistan at all. That is the best possible thing in Saudi Arabia. You just call any of the consultant, and that will be available during the surgery, and to help out the best possible results.
सर आपका AMDC में जनरली एक्सपीरियंस कैसा गुजरा है?
अल्लाह का शुक्र है. आई थिंक एवरीथिंग हैज़ बिन गोइंग वेरी नाइस, एंड because of the corona, 2-3 years which were passed, they were very what we call not good for everybody, practically speaking, and as well as for the college, because interaction was limited, and we had to stop many of the activities which were going on previously in the college, and now we are trying to take them back, like the dental conferences, the different courses which are to be done have been going on in this college, and we will inshallah restart them, and we will try to take the things positively again.
सर कोई मैसेज देना चाहेंगे आप AMDC के स्टूडेंट्स के लिए, कॉलीग्स के लिए?
आई थिंक AMDC के सारे ही स्टूडेंट हमारे लिए बहुत इम्पॉर्टेंट है इस लिहाज से, बिकॉज दे आर द रिफ्लेक्शन ऑफ वी पीपल. If they will perform anything good, we will have a good name. And if they will do any activity which is not in the favor of the society and not in the favor of the other people, probably our name will be destroyed or will go to the negative side. So I will just advise, you are always welcome to contact me for any type of what we call service from my side, or any type of help from my side, or any type of guidance from my side. I will feel happy, and I will always be there to help you as much as possible, and I will always expect that you should go up as much as possible, and we will be happy to see you at the highest place.
सर थैंक यू सो मच, आपने
थैंक यू
हमारे लिए
वेरी
टाइम
मच।
निकाला।
थैंक यू जी, थैंक यू वेरी मच।